If you clicked on this video, you're probably suspecting that you are in perimenopause and you don't recognize your body anymore. Maybe you're exhausted in a way that sleep doesn't help. Maybe your brain is not functioning the way that it used to, and you're thinking, is this brain fog? Maybe your cycles are getting a little bit more irregular. But overall, what women tell me is they don't feel like themselves in their body anymore. And you saw the title, What is Conscious Perimenopause? So great job for clicking on this video. I'm Dr. Giselle, and I'm a medical doctor with 20 years of experience, and I'm a functional medicine hormonal expert, and I dedicate my time to help women go through the transition we call perimenopause. Before we continue, I want to flag one important. Everything I share in this video is not for treatment, but for education. I don't know your personal story. I don't know your test results, your labs. I don't know your body the way that your health caregiver knows your body. So please do not end, start, or discontinue any treatment without consulting with your caregiver. With that being said, let's get into what is conscious perimenopause. Before I can go into what conscious perimenopause is, I have to share with you my personal story. So, my personal story started at the age of 11. That was the start of my period. And in the beginning, it was okay. A little bit of pain around my stomach here and there, but it was okay. Pretty soon, early into my puberty, I would have debilitating migraines every month. In the beginning, I didn't connect the dots. I didn't understand that right before my period, my migraines would come and it would last for 2 to 3 days. I honestly don't know how I managed middle school, high school, and medical school with those debilitating migraines. And it was in between the migraines, I will always have this slight headache. I remember during my pregnancies, and I'm a proud mom of four, that I would have none of that. Pregnancy comes with its own challenges, but it will be such a relief not to like feel my head. So later on in life, between 30 and 40, PMS got really bad. Debilitating migraines that would last for days, very heavy periods, fibroids the size of a grapefruit, being anemic, gaining weight. It was bad. It was bad while I was practicing medicine. It was bad while I was asking myself and my colleagues questions like, what is happening to my body? So I said before, I don't know how I made it through med school with the heavy PMS that I was suffering from, but I know now how I did it. I did it by completely abusing my adrenal glands. I tapped into my cortisol and I used up my cortisol to get to my goals. My goals became more important than my body. So at the age of 42, the diagnosis came, which is not a surprise. I got burned out. But burned out was part of a bigger picture. Burned out was the beginning of what I know now and didn't know then, perimenopause. You see, back then when it started, the word perimenopause wasn't even adopted in the guidelines. See, I had all of the other diagnoses, PMS, burned out, anxiety disorder, even depression, and got prescribed all of the things, birth control pills, antidepressants, SSRIs. Every doctor was looking at their field of expertise, but no one was connecting all of the dots to understand that by that time I was in perimenopause. So I wasn't conscious of perimenopause, and my caregivers were not conscious of perimenopause either. So that was the birth of conscious perimenopause, going through this transition consciously. So the conscious perimenopause takes you through perimenopause through three different stages. The unconscious stage, which is characterized by what is happening to me. You are suffering from perimenopause. Perimenopause is this big old entity that is causing you to suffer. So there's a lot of blaming on this of the symptoms, a lot of blaming of life. Why am I going through this? That is going through perimenopause unconsciously. Then you go through the stage of subconscious. You start to connect the dots. You start to see the patterns. You don't know the answer yet, but you start to understand that this is not happening to you. This is happening with you. And the last stage of perimenopause is the conscious stage. I call her Conscious Christina. And in this stage, it's not happening to you, it's not happening with you, but it's happening for you. You start to understand your body, you start to understand that symptoms are guides. Symptoms are signals. And you start to work with those symptoms to guide your body, your mind, your emotions into the space that you want to be. So there are three pillars in conscious perimenopause. If you pay attention, there are a lot of trees in conscious perimenopause. There are three stages, there are three pillars. I love to work in threes. So the three pillars of conscious perimenopause are biology, lifestyle, and spirituality. Biology is the part that we look at the numbers. I do extensive lab, not just estrogen, progesterone, and maybe testosterone, but I check all of the hormones, cortisol, TSH, your thyroid gland hormones, insulin. All of those paint the picture of perimenopause. Perimenopause has been presented to us as a decline in estrogen, and that's it. And that is not the full picture. Yes, estrogen decline, and before that, progesterone and testosterone starts to decline. But there are also other hormones that starts to elevate, and we don't want that. Hormones like cortisol, hormones like insulin, and checking into that to paint the bigger picture of what is happening in your body is so important. And then I do also the testing of hormones in your urine. We call that the Dutch test, the dry urine testing comprehensive hormones. Why? Because I want to know the bioavailable hormones in your body. The hormones that I test in your urine are the hormones that come from your cells. And I want to know, how is your body metabolizing these hormones? Are the hormones that are in your serum available for your cells for you to function? The second pillar of conscious perimenopause is lifestyle. There is so much research that says that our lifestyle is so much affecting our hormones for male and female patients. So the way that you sleep affects your growth of hormones, affects your testosterone. And testosterone is a very important hormone for the female body. It's not just a male masculine hormone. The way that you eat affects your insulin, and your insulin affects your cortisol, and your cortisol affects your estrogen. The way that you move affects your cortisol, or the lack of movement can also affect your body. Your lifestyle choices can create inflammation in your body, and all of that inflammation can also affect your hormones. So paying close attention to your lifestyle choices and how you eat, sleep, move, manage stress is as important as your biology. And the last and important part of conscious perimenopause is your spiritual journey. You are transitioning from a reproductive phase of your life to a non reproductive phase in your life where your nervous system regulation becomes so much important. I see and feel in the West that we treat perimenopause as a decline, as a decay, as something going bad. But there are a lot of cultures that treat perimenopause as a sacred transition. What is the story that you're telling yourself when it comes to perimenopause? What is the identity? What is the new identity that is trying to come out, is trying to be birthed? Who do you have to grieve and let go of, and in order to embrace the new person? A lot of women are carrying these questions that affects their relationships, their career choices, and we incorporate all of that in your hormonal care. So in perimenopause, there is a lot of attention on HRT, hormone replacement therapy. And I truly believe that every woman going through perimenopause deserves to have a conversation about hormone replacement therapy and deserves to be prescribed it when it's safe. But HRT is not the complete story. And that is what I cover with Conscious Perimenopause and the three pillars, because I have women coming to me with HRT and they're still struggling. And then we take a look at the numbers, and then we take a look at the lifestyle, and then we take a look at spirituality. But I would advise that we cover biology, lifestyle, and spirituality while we are also prescribing HRT. So that was what is conscious perimenopause. If you have recognized yourself into anything that I'm saying, and you're thinking, hey, maybe conscious perimenopause is something for me, just comment Perry and I will reach out and we can start that conversation. And if you have a friend that is going through perimenopause or PMS and you're thinking, hey, this was interesting, please share this video with her and let's spread the word so that as a unit we can start going through perimenopause, not unconsciously as if something is happening to us, but consciously knowing that it is happening for us. So I hope to see you in the next video and bye for now.